Hello, everybody. Welcome back to another great conversation on the Healthy Project podcast. I am your host, Corey Dion Lewis, and I have a really great guest in a conversation today. One that, I have not had a conversation about dental health in so long, but this is a little different because we're talking not only about that, but technology, public health, and how we bring those together. Our guest today is Pam Oren, the COO and co-founder of GRIN, a digital oral health platform that's reimagining how care is delivered, particularly for the more than 57 million Americans living in oral care deserts. Pam is a mission-driven tech leader who's building solutions that don't just scale, but uplift. Pam, thank you so much for being here. I really appreciate it.
Thank you, Corey, for having me. This is great.
Yeah. So, before we get in the conversation to talk more about Ben or GRIN, and your mission, can you tell the people a little bit more about yourself and what gets you up in the morning?
Absolutely. So, where do I start? So, I'm a person of many hats. I started my career actually as a software engineer, software and electrical engineer, and kind of grew my career in small and large companies. Went through multiple kind of company life cycles, whether in IPO events or acquisitions. I worked for a small company called Apple for many years through a startup that was acquired by them. So, and also from a functional perspective and a role perspective, I played many parts. So, like I said, I started as an engineer, but then grew into more product and operational and strategy roles throughout my career. Somewhere along the line, I also did my MBA and while other people focused more on, finance and consulting side of that space and how could they make more money with their degree, I actually was really focused on courses to do with corporate social responsibility and public strategy and so forth. So I always knew that somehow I would take my technology experience and apply it to making impact, and really wanted to work for a company that makes this world a better place.
Man,
So that's a
that's
little bit
amazing.
about myself.
That's amazing. So I would love to talk more about, what I love the background in technology, and what inspired you to co-found GRIN and why oral health, something that is often overlooked in the health tech conversation.
100%. So it's funny that you ask that question this way, that is so often overlooked, because I myself was one of those people where and you'll hear it in how we started GRIN and how I came to be about a founder of GRIN, on how this really wasn't friend of mine for me. Or like I said, throughout my career, I was involved in many outlets of activity, let's call it. And in one of those activities, my husband and I were actually amateur investors in a startup in the health tech space. It was a different space than oral health, but this is how I kind of came into the community of founding partners. And then when that company kind of was successful and sold to a large medical device company, the founders reached out to me and said, there's this really interesting problem in oral health. There's a large gap where people are actually due to issues with access, they're turning to suboptimal solutions. So I was like, wow, this sounds like a pretty interesting gap and hole, but what do I have to do with oral health? And but it kind of stayed in my mind as a problem. And I remember I said, give me a few days. I reached out to a community that I have of business professionals that again that I know from my career. And I some, and they're all about they're solving problems in different disciplines and different industries. So I knew that I would get, the variety of information. And I reached out to them and I said, listen, anyone who is willing to talk to me, I'd like to interview you. And I think I interviewed a dozen a dozen of these business professional people over one weekend. And I came back to my now founding partners and I said, there's definitely a hole in this industry and there's definitely an opportunity to fill it. And that's how we founded GRIN.
Wow.
That's our story. I can go on and on about kind of what the product does, but I'm sure you'll have questions about that
Yeah, absolutely.
as we move on.
Absolutely. You know, was there a particular moment or even insight that kind of crystallized the need for a digital first solution in oral health deserts?
Listen, we can take a step back and talk about the actual data.
Hmm.
So there's lots and lots of data and articles, and the problem is being crystallized in and is getting now more attention, thankfully. But I think the large information that maybe the audience needs to understand is that 1 in every 2 people in the world is suffering from some kind of dental ailment or dental disease. 1 in every 2. So it's approximately 3.5 to 4 billion people are actually affected by dental disease, and which is the most prevalent NCD issue. So non communicable disease, which is just like with cardiovascular disease and other diseases that are non-transferable. And same goes for oral health and oral disease. I don't think people realize that. And then the other point in the data is that why do people not get oral health care or don't take care of their dental issue? So a lot of it basically it revolves around barriers that are actually fear, cost, but then also access
Hmm.
and shortage in providers. So that's like one. If you look at it kind of top down, the data is there. But for me, on a personal level, and let's call it bottom up, I think there were a few moments that really crystallized the need in taking our solution and really taking it to the public and to public health and solving larger public health issues was with early on we did a few experiments in and collaborated in Head Start programs. Those of you in the audience who don't know what Head Start programs are, these are programs for younger Medicaid programs for those younger age populations, ages 3 to 5, and they kind of enter into the healthcare system through help from the state to participate into these programs. So and participating into programs such as the ADA, the American Dental Association, Give Kids a Smile, and going into these large population events where we can use GRIN to really scan what's going on in these children's mouths really crystallize the need, because the type of things, Corey, that we saw in these patients' mouth, and these are things that these patients are not being able to, they can't even communicate. So it's
Mm.
kind of like, hey, the data is there, but seeing is believing. So when we participated in some of these, and I personally, with my own hands, used GRIN to scan some of these patients, younger populations, and then also elderly adults. And it's just mind blowing that we have so many people amongst us walking in the streets, kind of participating in school, and the inside of their mouths is actually not being seen and not being taken care of. So that to me was a huge light bulb event, if you call it, to
Yeah.
understand that we really have to serve this population and we can really reach into those patients' mouths and help them, prioritize them, triage them, help them be seen, and then take care of the issue
Yeah.
after that. Yeah.
What I hear you saying, this really kind of closes that gap in care where a lot of these kids and their families maybe don't have access to transportation to get to a dentist or something like that, or they're growing up where you're not going to the dentist until you have a toothache or until there's like pain. Um, and that by that point it's too late, and now we're developing these very bad dental preventative habits. if that makes sense.
Yeah.
And yeah, so being able to do that, and I'm sure, as a kid, is probably a little less scary than going to a to a clinic most of the time.
You hit the nail on the head. There's a instilling those healthy habits or preventative habits is such an important discipline that we should teach our population at an early age. Um, but this goes, and I'm sure we'll talk about it later, kind of during the show. But there's a just a variety of ripple effects of not dealing with or not instilling that preventative discipline in a person's or in a patient's mind early on in their lives. So, as an adult, if you were suffering or you didn't take care of early in dental decay, then the issue then becomes much more acute. You then become obviously a critical care patient where you have to go into the emergency room, unfortunately, and then the costs go higher. So you're an absentee from work, you lose salary, the company loses
Hmm.
efficiency. So there's just a ripple effect of obviously of issues that because our mouth and our oral health, sorry, is overlooked, it just creates kind of a magnitude of issues later down the line. Not to speak about, and I'm sure we'll also touch on that in the later down the show, but not to speak about the strong linkage between oral health and full body health. So
Yes.
what we now coin as the oral systemic health. And that's something that I'm also personally very passionate about. If you, the industry has now been able to um, not only prove correlation, but also causation
Mm,
by oral health issues into um, other large medical issues, the major ones like cardiovascular disease and cognitive issues, premature labor, diabetes are all more critical and more terrible, so to speak, if you start from oral disease in the mouth. So that's
interesting.
something that's definitely another issue that is not as known, but is starting to be. We're starting to build a little bit more awareness when it comes to that.
That's very interesting. Pam, as a clinical health coach in a safety net hospital, that is my a part of my role. The oral health as a preventative measure, as far as my role, never comes up. And oral health is rarely centered around in public health dialogue. Why do you believe it's critical to treat it as a core social driver of health?
We hear this all the time. What you just said, we speak to. You're not alone. We go to, and more recently I've spoken to so many community health leaders, community health center leaders on the medical side who tell me exactly the same thing. Hospital personnel, long-term facility and head nurses and educators, and they say exactly the same thing as you said. It doesn't come up. So why do I think it needs to be kind of center as like as a social determinant of health, sorry. So mainly for two reasons. Number one is our smile, and when we open up our mouths and we smile, it's directly linked to our what we feel about our self-worth,
100.
how we show up, how we build our confidence, but also going from our self-worth, confident, it's also how we perceived. If our mouth is unhealthy, a lot of times, and it's already been proven that there is reduction in economic opportunity, meaning being able to land a job if you have oral health issues. So you'll have more trouble to land a job if your smile, not straight, yellow, etc., missing teeth. So that's kind of on the self-worth, and then the impact on you kind of socially and economically. The other side, which is what I discussed previously, is the oral systemic health, right? So the fact that our mouth is part of
Mm.
our full body, and now that is directly linked to some of these kind of more serious chronic conditions, and it can affect them to become worse. So basically, our mouth, while it's overlooked, it's actually central to our overall medical health.
Man, I need to do a better job. I need to go.
Yeah, yeah,
um, and you kind of touched on this a little bit, but I kind of want to, if you can, maybe go a little more in depth, if that's okay. Some of the, the downstream effects, so the economically, medically, or socially, of poor access to oral care. What are some of the things that people may not realize?
yeah. So I touched on the linkage to the oral systemic health. I touched on kind of the self-worth and the economic result of it. There's actually two more direct or personal examples when it comes to kind of the downstream effects economically, medically, socially. One of them is we talked about absenteeism. It's kind of crazy. We are now engaging with one of the largest manufacturers in Brazil, for example. And you can think about, that's just one example, but you can think about a lot of large employers in the US and in other countries in the world. And a lot of times what they would do is, in order to streamline care or, benefits for their employees, they would have some kind of medical care in-house or tethered to the organization. Today, it has also become kind of, and I think you may have spoken about it in your podcast as well, it became also trendy for the right reason to have mental health be part of that ecosystem of available resources for employees. So this larger employer, very large employer in Brazil, reached out to us and said, "You know what, GRIN? We have a medical doctor. We don't have a dentist or an oral health professional in-house providing services as an extension to the team. But what we realized counterintuitively is one of the main reasons for people not showing up for work, basically for absenteeism, is oral health and dental issues. So
Mm,
it starts with them ignoring toothache or not taking care preventatively of oral health issues. And then it becomes, okay, I need to go to the emergency room because I can't make it to work. And that becomes their number one issue for medical reasons for absenteeism. So if you can take that example and apply it across the board, you'll understand that this is a major issue for people, either losing salary due to not making it to work and having to take time off, not to talk about having to take time off because of their loved ones or their
mm,
guardians having to take care of other people and taking them logistically to take care of that issue. The other reason is it ties to an example I gave before about some time we spent with the communities using GRIN to reach into these patients'
mm,
mouths. And now through our providers, it happens everywhere and all the time across the US. But um, what's crazy is to actually see a result of malnutrition.
mm,
So it's again another thing that gets overlooked, but a lot of times with these populations who are marginal or younger populations or older populations, so whether these children who are 10 and under or even 18 and under and are in the school system but are not being need to be taken to see a dentist and are not necessarily being checked, or in long-term care facilities where, again, also harder to communicate what the issue is and don't logistically very hard access to dental care, what we're seeing is that painful mouths actually lead to not eating, not sleeping, and difficulty to focus. And the result of that is also detrimental over time, if you think about it, when you apply, that issue with children and so forth. So I had, multiple times the opportunity to see firsthand and children. We scan them with GRIN, which allows us to asynchronously kind of provide the imagery to the necessary provider, the dentist who's not necessarily there, but to create that connection ecosystem. But I'm there seeing the child, and I don't need to
Right.
be. I actually don't need to be. I'm not a medical doctor. I don't need to be in order. I'm a mother of four, so I can relate to
Right.
what the child is feeling. But anyone can see when the type of tooth decay that these children sometimes have, and you can immediately extrapolate on their day-to-day experience as a result of what's going on in their mouth. Um,
Right. Wow. Um, you've spoken about building equity into the infrastructure of a product and not treating it as an afterthought. What does that look like in practice at GRIN?
That's a great question. I think I may have mentioned that at some point in my career, I also was a product manager. So these type of questions are very near and dear to my heart. Is how do you build from the ground up in the best possible way while thinking of all the factors that come into play. So to answer your question, I think there are multiple things, but one of the things that GRIN really, really focuses on and is notorious for is number one, simplicity. So, really straightforward, intuitive tools that are easy to use. Number two is accessibility of the tools. So, it can work anywhere and anytime and from anywhere. And the third thing is affordability. So we design our tools really to kind of with low cost front and center so that it's inexpensive and can be deployed easily.
Oh, nice. And how do you ensure that these features and workflows are designed to serve communities that are often digitally excluded?
That's yeah. So this is something that we've basically designed really from the beginning. GRIN, and we've improved also over time. There were multiple occasions where we kind of encountered issues, even in our own design. But then we went to make sure that this is a core kind of value of what we deliver. So we went to fit to, and what we were always trying to achieve is that you basically don't need broadband. You don't need a computer. All you need is a smartphone, and most people have one. And even in remote, secluded areas, or if you're in a basement of a hospital or in a basement of a church where you need to see many children, and you can use GRIN, just using a phone and scanning them one by one in a very efficient and effective way. So really, that's how GRIN is designed from the ground up.
No, I'm super curious too. Like, what metrics or like feedback loops do you use to gauge whether GRIN is actually delivering on its equity goals?
Yeah. Um, APIs, again, speaking like a true, I guess, operational manager and product manager, this is my favorite topic. How do we look at the data? And how do we, make sense out of the data? And how do we continuously improve over that data? So this is, again, something that I hold myself at the highest standards as well as our team. But if there are a few things that, just to answer your question, number one is efficiency. So we have to make sure that whatever the care team and the providers who are using our tool, we're not making them, we're making them faster, we're making them better, we're allowing them to basically see a larger amount of patients. And so efficiency is one of the key things that we are looking at. And I'm proud to say that we've done some studies and using GRIN and scanning patients in remote areas. We were able to achieve results of 2 times faster in their workflows. Now, 2 times faster might not mean much, but in the grand scheme of things, that might mean that I've returned 3 to 4 hours a week for them,
Mm,
or sometimes a day, where they can see more patients or do other things. So that's on the efficiency side. The second thing is actually measuring the lives touched. So were we able, thanks to GRIN, allow these providers who are out there in the field to see more patients? Were we able, thanks to having GRIN, allow a provider to consider going to another location, distant location, going to another long-term care facility because they feel empowered and enabled because they
right.
have GRIN. The other thing, which is also a very high metric that I love, or very high importance metric that I love, is behavioral change. So we talked about preventative activity before that, and how do we drive change amongst communities when it comes to taking care of their oral health. One of the things we were able to do with GRIN is we ran a study where, using GRIN in tele-dentistry communication, where you have a clinical provider on the other end discussing with the patient on how they could do better in terms of their oral care, are we able to see change over time? And guess what? We were able to see that in a study where in this case, I think we had 1,000 subjects, where we showed that over a course of 6 months to a year, if there is intervention by a care professional on the other side that can see what's going on in the patient's mouth and asking them to change habits, we actually saw that there's a 53% reduction in plaque pixels in their mouth. So think about it. Now these patients are healthier,
Mm,
and it's all thanks to a very simple activity that they did of taking an image of their mouth and having, an asynchronous intervention from a care professional on the other end. And then the last, I think you asked me about KPIs. I think that maybe another very important KPI is, are we able to reduce the health system burden? So from the health system burden, are we able to reduce kind of the cost of care on an individual basis and on a population? And then are we able to reduce, and then from the other direction, as from a patient perspective, are we able to reduce their health system burden by saying, okay, now I don't need to take a full day off work in order
right.
to travel to be monitored or to be seen by a provider that doesn't, and have to go back and forth, back and forth. I can do that in a more efficient way and maintain my health, basically. So I hope I answered your question, but
You
I have
did.
a lot, to say about, performance metrics and how we measure, our influence and impact. Yeah.
Yeah, there's something, one of my main questions I ask myself when I'm having these conversations, or if I'm thinking of something on how we can reduce, the barriers in some of our under-resourced or underserved communities, is some of these people they have to come see me, and when they're taking that time off, they may work at a job where they don't have paid time off, or the time they're off, they are taking that unpaid. So how can we make this as efficient for them as possible? Make it worth it for them. And if I can't answer that question, like, is this going to be worth it for you to miss that, whatever that is, an hour? That's concerning. It's like, oh, that kind of sucks. That makes sense. So it's one of those things where, for those that may not have some of the privileges as others, where they can just say, I'm taking a couple hours and still get paid. What are some of the innovation that we can do for those people?
That's the core of what GRIN does. So GRIN, I have so much to say about this. I don't have the full statistics, but what you just described is an everyday issue for so many Americans, right? And
Mhm.
I can tell you, even as someone who theoretically could take the time off because I do get paid not on an hourly basis, etc. Just as an individual, I can tell you that I think twice because on whether to go. I sometimes delay my own, appointments
Yeah.
because I'm prioritizing other things. So you can only imagine if I were to get, to lose pay as a result of the consideration that is going through the minds of so many
Mhm.
Americans. Absolutely. So, but to answer your question, GRIN's technology has that built in a foundational way. All we think about all day long is how can we streamline these activities for the patient and the consumer, as well as for the provider, because it is important for us to also make sure that the provider has the tools to be as
Mhm.
efficient as they can with the population of patients that they treat. But first and foremost, we believe that once we address kind of the ability to streamline the the care for the patient, the individual, then the provider will also jump onto that bandwagon of care loop and want to provide the care. So there's like a two-sided network effect situation here, where
Mhm.
we want to ensure that you know the patient has the utmost convenience. And by when I say convenience, I don't mean like luxury convenience. I mean
Right.
convenience in terms of, okay, this is easy enough for me to be able to use the platform, and therefore I will seek the preventative health that I need, or the health advice that I need immediately. And from there on, it just gets better over time because I'm in the care loop versus being outside of it.
Yeah. Pam, I'm super curious. What does this mean to you to be building a technology like GRIN that uplifts, rather than just scales? I mean, I understand scaling and stuff that's important, but how does it feel to be doing something that has such an impact?
I've always wanted to be on the side of doing well by doing good.
Mm.
So I know this may sound like a cliche, but that sentence stuck into my mind from, the early days of my university education. And uh, I've always wanted to be on that kind of, always wanted to have that be the motto of my career. So, I believe that the scaling will come as a result of the uplifting, to answer your question. So as
Mhm.
long as we can, uplift, the solution can stick. And then as a result of that, we can scale. Um, in the world we live in today, I'm sure I don't have to tell you, there's so much uncertainty,
Absolutely.
global friction, economical, internal friction. There's so much. What will AI do to our jobs, et cetera, et cetera. I think it's a very grounding feeling to be able to look at each patient that you helped, one patient at a time or one day at a time. And once you realize that you've been able to um, help um, impact that patient's life, and give give them a smile or help a child thrive, you know that your product helped kind of make that happen. That's the ultimate ROI. You ask about, uplifting versus scaling. When we talk about scaling, we talk
Mhm.
about ROI and return on investment and so forth. The ultimate ROI is once you know that your product really helped one person at a time achieve their smile, get better about their health, and so forth.
100%. That's amazing. So I'm gonna ask you a pretty big question, which is, is something look in the future for is where do you think digital oral health will be in 5 years, and what role will GRIN play in shaping that future?
That's Very good question. I think there are probably three or four things that I'll focus on in the near future, in the next 5 years. We will move into much more automated diagnosis, which means that whether with GRIN or with a different tool. Hopefully, it would be with GRIN, but you can take a scan of your mouth and automatically we would know what's going on in your mouth, so that could really streamline the process of then receiving care. It would be much more personalized and data driven in terms of what your care plan is going to be. So, a quick example for the audience that kind of lives with the mantra of, okay, I need to go to the hygiene. I know that according to the way I was brought up, I need to go and see the dentist once every 6 months, right? There is a world 5 years from now where some patients will need to see the dentist once every 3 months, and some patients will need to see the dentist once a year. It really depends on what your personal condition is. And then going from there, the different care recommendations that you would get are much more personalized to whatever the condition is. The other thing, and the flip side of it, is that the care would actually be much more transparent and standardized. So there's this, for those of us in the oral health and dental industry, there's so many misconceptions about by patients, justifiably and unjustifiably, that they're trying to oversell, or they're trying to get more money from me when I go to the dentist, and so forth. So now, with automation and personalization, the next step is going to be standardization of what, if you go to one dentist versus the other, how much something would cost, and why is that the recommendation for you. And then the last thing I would say is probably the holy grail of part of our conversation today, which is full integration with the medical system.
Mhm.
We always talk about someone taking a very interesting, and for some of us, not, we're not sure whether it was a smart decision to bifurcate the two systems 100 years ago. So you have your medical insurance and then you have your dental insurance.
Yeah.
A lot of us believe that those should be merged back together to be part of the full system, because there's so much connection between your oral health and your full body health, as we discussed. But in terms of GRIN's role, we hope to lead that transformation. We really do have the tools to help do that on many levels, both in terms of the hardware and in terms of the software and the algorithms, but also kind of the cultural attention to what is needed in order to go through that paradigm shift. And we really hope that GRIN would be that smart catalyst. Uh,
Mhm. No, that's amazing. What I really love about, health tech right now, there's so many people innovating and trying to do really, really good work. And what advice would you give to founders of health tech or health tech innovators looking to build more equitable products?
yeah, I would say start by listening. So I know, again, this might sound a little bit cliche, but equity can't be bolted on. It has to be a foundational thought.
Right.
And once you kind of listen to the users that are actually less visible to you, and then you would find the answers on how to design your product in a more equitable way. So, yes, just build with them in mind, and don't consider that to be kind of an afterthought, or, you'll bolt them in after the fact.
No, I love that. Pam, thank you so much for your time today and on letting me know that I need to be thinking more about my oral health care from not only for myself, but for the people that I serve. For those that are listening or are watching this interview right now, where can they, and they want to connect with you, where can they reach you? Where can they learn more about GRIN?
Absolutely. So number one, welcome to reach me in my email, pamela@get-grin.com. And just go to our website, get-grin.com, or on LinkedIn or any one of those social media platforms like Instagram or Facebook. We're there, and we're publishing, a lot of the stuff that we're doing in the communities and in the private sector as well as the public sector. And then I would say, are interested to continue the conversation. We already have conversations going with associations, whether it's the National Association of Community Health Centers, whether it's the American Dental Association. We're having conversations with public health, some policymakers, public health leaders, and we're having conversations with medical device leaderships as well. Everyone kind of wants to be part of the conversation. But if there is one thing I will say, is that we are doers. We're looking to collaborate with people who are not just talking about the fact that there's a problem, but are also ready to walk the talk and are ready to actually do. We are the technology. We are enablers. So we at GRIN feel like the solution exists. It's just a matter of taking a decision to implement it and deploy it, and the change will happen inevitably.
Oh, that's awesome.
So anyone who is ready to do, we're ready to talk to you. And while I understand that change doesn't happen overnight, we're very eager to start making change. After all, the mouth is the front door into the body. So that's one thing I'll leave you with.
Yes, no, I love that. And we'll end with that. Pam, again, thank you so much for your time. This was awesome. I'm so glad we're able to do it. Everybody, thank you for listening to the Healthy Project podcast. I'll highlight you next time.
Thank you so much. And thank you for lighting this light on this important issue that a lot of time gets overlooked. Thank you so much, Corey.
And hopefully this won't be the last conversation we have about oral health care.
Thanks so much, Corey. It was a pleasure.
This episode of the Healthy Project podcast is sponsored by GRIN, the digital oral health platform making dental care more accessible, affordable, and convenient for everyone, especially in underserved communities. With GRIN, providers can reach patients anywhere, no broadband required, and deliver the preventative care that keeps smiles healthy and bodies well. Learn more and see how GRIN is closing the oral health gap at get-grin.com.